Tonight, there clearly is growing frustration among parents who want to get their very young children vaccinated against COVID-19. The FDA's decision now to delay the process has raised a lot of questions. Let's discuss this and more with Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases and President Biden's chief medical advisor. Dr. Fauci, thanks as usual for joining us. One of those frustrated parents is Dr. Lena Wen. Woman you know, she joined us on this show on Friday and said the FDA's decision felt like a gut punch, her words. What do you say to parents like Dr. Wen who feel like they've had the rug pulled out from under them?
Well, you know, I wouldn't describe it that way, Wolf, that the rug has been pulled out. I think it's disappointing that parents who have children in that age group certainly are anxious and want their children to be vaccinated, but you want to make sure it's done right. And what the FDA is doing is there doesn't appear to be any safety issue at all. They want to make sure that the dose regimen that will be used is the correct one. Namely, it's a 3-shot vaccine for children. They originally got data from the 2-shot vaccine. They didn't feel for them to make any final determination. So they're now collecting a considerable amount of data, making this a 3-dose vaccine. The data will be collected, it will be presented to the FDA, and in their usual manner, they'll go over it very carefully. And when they do, and if they do, and it likely will be when, then you'll know you have a vaccine that is safe and effective. So it may be a bit of a delay, but I don't think it should be considered a major setback. It's merely a matter of timing, Wolf. And you always want to make sure, particularly when you're dealing with children who are inherently the most vulnerable, you want to make sure you do it right. And that's what the FDA is doing. They want to make sure they get enough data so that with confidence, when they make their decision, it will be backed by good, solid data.
Well, let me press you on a timeline, Dr. Fauci. When do you expect data from Pfizer about how young children, 4 and younger, fare after a 3rd dose?
Wolf, you know, I can't give you a timeline because that's up to the FDA. They're saying they'd like to do it within a period of a few weeks, but you'd have to ask them because you know what happens in this world we're living in. I'll give an estimate and all of a sudden it'll be different from what really happens. Let the FDA speak about when they feel they'll have it. So I don't really want to make that kind of conjecture.
As you know, mask mandates are being lifted across the United States right now in so many cities. Are we moving into a phase where decisions about mitigation measures can be left up to individuals rather than state and local governments?
Well, you know, Wolf, where we're going right now is that, first of all, we're going in the right direction. If you look at the curves, which is fundamentally, virtually exclusively Omicron that we're dealing with right now, the curves have sharply turned around. They're coming down. They continue to come down, both with regard to the cases and the hospitalizations. If it continues to go in that direction, you're going to be seeing the CDC makes the recommendations. At the end of the day, it's for the locals to do it. And we would hope that the local health authorities, depending on the situation in a particular region, a particular state, a particular city, will utilize the data and the recommendations that the CDC gives and make their own determination based on what's going on in their own particular local area. That's where we believe it will be going. And hopefully, Wolf, if we continue to go in this direction, we'll start to see a lightening up of the mitigations that are going on, which is what we're all hoping for, because nobody likes restrictions. Nobody likes to be wearing a mask all the time. But it looks like we're going in the right direction in that regard.
So you think we're finally, we're now in almost year 3 of this, nearing the end?
Wolf, I hope so. Again, we always got to be prepared for the best case scenario, which we're hoping for, which is what I believe you're suggesting, that this infection goes way down, it stays down, we do well, and we're not surprised by yet again another variant. And that's something that's unpredictable, but that you can prepare for. You can prepare by developing better drugs, by making sure that testing is easily available, and by getting more people not only vaccinated but boosting. One of the things we have to keep emphasizing, Wolf, that the booster shots do extremely well against variants as they emerge. So we're prepared to get a new variant. I hope we don't. And I hope we continue to go in that downward trajectory where we can start approaching some degree of normality that all of us are craving for after such a long period of time under this veil of a very, very serious outbreak.
We're certainly hoping for that. Dr. Frauci, as usual, thank you so much for joining us.
Joining me now for more on this is Dr. Edith Bracho-Sanchez. She is a pediatrician at Columbia University's Irving Medical Center. It's great to have you here live and in living color. Thanks for coming in. So Dr. Fauci made clear he does not think this is a major setback. That may and is clearly true according to science, but for parents who are feeling this with kids under 5, it doesn't feel that way. What do parents need to know about these trials, about the delay, and about what happens next?
Kate, I am one of those parents. I understand the frustration. This has been a long time coming, and we were so close, and I thought the conversation we were going to have today was going to be different. I think it's important for people at home to know that science takes as long as it takes, and that you want the steps to be followed. You want enough data to be accumulated. You want all of the data to be accumulated, and you want the experts who are making recommendations on these vaccines to have been able to have the time to look at all of the data, and that is what's happening here. More data is coming. The experts are taking the time to really review it and tell us yes or no.
The youngest group that is approved to get the shot right now, from the 5 to 11 year olds, the vaccine rate amongst these kids is still stubbornly low. We looked this morning, for 2 doses, it's 23.9% in that group. I'm wondering, as a pediatrician, what message you have found that works, or what really is not working in talking to kids, talking to their parents to convince them to get a shot. It will apply when this next group gets the green light as well.
That's exactly right. What I'm seeing in my office, Kate, is that parents are saying, why would I do this? This is a mild illness in children. And I think, unfortunately, that idea took root. And it's been so hard to tell parents, listen, this is a lottery you're playing each time. Your child is vulnerable every day that they're not vaccinated. What I have found works is to say, I understand you're thinking about this. Let's put a deadline on it. Let's think about it for 2 weeks. What information do you need to gather in the next 2 weeks? And let's set up follow-up, right? Let's set up another visit to talk about this again. And you can ask me any additional questions that have come up. But the sort of wait, I'm not sure, and it just sort of, lingers. It's not really the way to go.
The deadline, that's interesting. I hadn't heard about that. Like, setting a deadline to follow up is a great idea. State officials in general are citing the falling case counts as the reason for pulling back restrictions, lifting mask mandates, and the like. But when you look at it, vaccination rates in the United States are falling at the very same time. We just looked, and new vaccine doses fell 57% in the last month, and new booster doses are down 65%. And I'm wondering, that all adds up to what in this moment, do you think?
I think it's leaving us in a really bad place. I think we are heading into the spring.
It's like good news and bad news at the same time, right? Like, you love seeing cases plummet, but then there's the but.
And we're threading this needle, right, of trying to give people hope, of saying, yes, the Omicron variant did turn out to be a little more mild. There's no guarantee that the next variant that might come after it is going to be just as mild, right? And we sort of want to give people hope, but at the same time, we need to be careful. And every time, Kate, here and every other country around the world, that we let our guard down, we see the numbers come back up and new variants emerge. It's just the reality of this virus.
Well, and the World Health Organization has been speaking to that, just warning that low vaccination coverage and low testing rates in other countries are creating, to your point, ideal conditions for a new variant to emerge. It's kind of like we've seen this before. We've seen this movie before.
We have, and you'd think we would learn, but I think we, as human beings, get tired, get, a little.
Well, the exhaustion's real.
That's exactly right. That's exactly right. And we're humans. We need the connection, but I think there are ways to go about this. We can set goals. We can set, collective things that we're hoping for before we ease restrictions. And it is the harder message, Kate. I know that it is the harder message to sell for politicians, but I believe it is the right message.
Well, if you're a leader, it's your job to lead. So there you have that. It's good to see you, Doctor. Thanks for coming in.